From the California State Senate, this is Senate Spotlight.
Hello, everyone, and welcome to this segment of Senate Spotlight, where we discuss legislative priorities and policy and other related issues with members of the California State Senate. From the state capitol here in Sacramento, I'm Brian Green, and joining us this time around on this segment of Senate Spotlight is newly elected Senator from Sacramento, Dr. Richard Pan. Welcome.
Thank you.
We're glad to have you here. You are a pediatrician,
yes,
former college professor. You have worked very hard, I know, to sort of build the bridges between doctors and patients and making sure that they get services in their community, medical and otherwise. So we're glad to have you. Give us some perspective. You are a freshman senator, but you aren't a freshman here to the Capitol. You were an assembly member for 2 terms before coming here.
Correct.
So give us some of that perspective dynamic between being a lawmaker and a doctor. How does that play out in the halls of the legislature?
Well, certainly my experience as a practicing physician and also in the university system as well helps bring me practical knowledge about what goes on in the front lines, even as we're talking about implementing the Affordable Care Act and other health policies, to bring the perspective of someone who understands what happens in practice. In fact, I still practice, and as I say that in the beginning of the week, I help shape the policies. At the end of the week, I have to live by them. And so I think that's a very important perspective to bring to help make our policies more effective and meaningful.
Well, I know making policies and living by them certainly has come front and center here when it comes to medical issues and communicable diseases here in California in the last couple of weeks. In fact, let's just get to talk about that because I know it's something that's front and center for you. We have all heard about the outbreak of measles at Disneyland a few weeks ago. I think it's nearly 70 cases, might even be more as we speak.
Now, yes.
Is it more now?
Yes.
Well, it has dominoed, and we're seeing it even in other parts of the state, other states. And there was this, before, this kind of herd immunity, as we have called it, where people were getting vaccinated and as a result not getting measles or not being contagious or not being affected. But now we're almost seeing the contrast where more and more people are not being vaccinated, parents not vaccinating their children, the anti-vaxxers as they are called, and we're starting to see some effect. This is not a new scenario, but as a pediatrician, you've seen it, parents opt out. How does it work? And the personal belief waivers, what's the dynamic that has happened that now here's playing out here in California?
Well, certainly as a pediatrician, I'm committed to the health of children, but also when I ran for the state senate, I ran to keep families safe and healthy. And so when it comes to a vaccination is really about the public's health, about public safety. I authored in the State Assembly a bill to ensure that parents had accurate information when they were getting their children immunized, or if they decided not to get their children immunized and still have them enter school, because vaccines are often the victims of their own success. Because of vaccination, people don't have a direct experience anymore with how deadly measles can be, or the fact that infants can die of whooping cough. Now, more recently, because the immunization rates have fallen and because people have received misinformation from the internet, from celebrities who've touted some misinformation, people have become uncertain about vaccines. And so some people are deciding to send their children to school without vaccines, not even because they're against vaccines, because they're just not sure. And so the bill that I did, AB 2109, required that before they could send their children to school without being vaccinated, that actually they would be counseled by a licensed healthcare professional. Now, with the outbreak that you saw with not only the measles in Disneyland, we had a record number of measles cases last year in the state of California, even before the Disneyland outbreak. We also had a pertussis epidemic. In fact, in 2010, 10 infants died of pertussis. All right, we've seen other infections as well. And so what I want to do this coming year is, number one, be sure parents actually know what the vaccination rates are at the schools that they're sending their kids to, and also with a reference rate. Now, we know what percentage of people need to be vaccinated to keep that disease from spreading in a community. And so parents need to be armed with that information, and then they can decide, if my child's at risk of being exposed to a vaccine-preventable illness, maybe I should work with the school district to get more people vaccinated, or change my kid's school, or whatever. But at least they have that information.
So it's empowerment and awareness for the parents.
But we also think that perhaps we ought to take some further steps. While AB 2109, which just got implemented this year, did reduce the number of children who entered without vaccinations, there are still pockets where that reduction isn't enough. And so I think given what we're seeing with the outbreaks that have been happening, we perhaps do need to take additional steps to protect the public safety. And ultimately, it's about people who can't get vaccinated. We have people who have cancer who are on chemotherapy, and they cannot be vaccinated because their immune systems are suppressed by the chemotherapy. Or someone may have a genetic or a chronic disease that suppresses their immune system, or they may have HIV or AIDS. And they depend on the rest of us to get vaccinated. So the decision to get vaccinated is not just about yourself or your child. It's about the community. And we need to remember that as we're making policy about vaccinations.
Well, tell us about the stats and the demographics. One might typically say that, there's a lower amount of vaccinations in maybe a rural community or a lower income community, but in fact, you will find it more in some of the more wealthier enclaves of the state. Is that true?
That is true. I think that actually we've seen higher rates of exemptions in often more upper middle class families where people actually ironically have more access to media like the internet. At the same time, we need to be sure we protect communities, more disadvantaged communities. In fact, we've been doing that through expanding healthcare coverage through the Affordable Care Act. And one of the things I'm very proud of doing is having helped write laws to help to establish to get Covered California going, to expand Medi-Cal. We've reduced the number of uninsured in the state of California by half in 1 year. That is something that we have collectively done in California together with our commitment to the ACA. That's ensuring that people can get preventive care like vaccinations actually at no share of cost, no personal cost, basically. And that's important because whether we're talking about measles or the flu, all right? The flu kills a lot of seniors, kills a lot of, last year we had a terrible flu season where there's many young adults who died of the flu. You can get, from the ACA, if you have coverage, you can get the flu vaccine without a copay, right? That's part of the ACA. And we're getting more people covered, so that if they do come down, they get sick, they can get care, but hopefully they can first get the preventative care. And that's really what that's about.
Well, yeah, the preventative care is a key issue, and I know in the wake of the Disneyland controversy, a lot of doctors have come out and said this was 100% related to people not getting vaccinated.
Yes.
And as so often as these things become controversies in the social stratosphere, things start to get ugly. Even the medical community, even some of your colleagues are out there calling the parents or the anti-vaxxers, as they are called, and this was a quote, "a privileged group of rich people who cluster and swear they won't put chemicals in their kids because it's trendy," that it's just pure misinformation, and just saying there's just a lot of crazy people out there. Now, I don't expect you to step into the debate on that, but can you understand where some of this frustration and even resentment may come from?
Well, unfortunately, there's been a lot of misinformation about vaccinations. For example, there was a discredited study done by a physician in England. It turned out he had faked the data. He'd actually done it on behalf of an attorney in order to try to get money out of vaccine manufacturers. But yet people still say that they said MMR, the measles vaccine, causes autism. There's no factual basis behind that. In fact, we've spent a tremendous amount of money studying that issue and showing that that's not the case. So there's a lot of misinformation that's going around about vaccinations. But more importantly, we need to think about what we need to do together as a community. How do we come together as a community to be sure we protect the most vulnerable among us? And that's what vaccinations are about. And that's really also what I want to work on, and I know that we want to try to work on in the Senate. So whether it's about public health and vaccinations, which we've just been talking about, or it's about health care, when more people get covered with health care, right? We're going to be able to be sure that when more people have coverage, we're better able to be sure we protect everyone's health, whether it's from contagious diseases or others, or whether it's about education or other services as well. We are all in this together. We want to help give everyone an opportunity to achieve the best they can achieve. We need to grow the middle class, give people the opportunity to succeed in their life. We need to do that, but it requires that we all work together to happen. Yes, it's for someone's personal effort, but it's also the supports that we can provide them. And that's what the state of California should be about. And that's how we became the Golden State, and that's what we need to continue. That's what I want to fight for in the state Senate.
Well, working together, let's fast forward, let's rewind and then fast forward a little bit on the issue of the Affordable Care Act and Covered California. Been more than a year since it began, kicking and screaming, embarrassingly so, especially on the federal level, into existence with the website rollout. Covered California had a better run of it here, and I think the stats from January, first part of this year, showed that 1 million people have applied since open enrollment started last fall, which is pretty extraordinary, and 1.5 million or so have enrolled since it started a year ago. So you, I know, were an ambassador, if you will, kind of an advocate, importance of getting people covered.
Exactly.
Looking back at this last year, what do you have to say? Proud of it? Where areas of improvement? What do you think?
So we've done a great job of trying to get people enrolled. As I said, we've reduced the number of insured by half, but we still have half to go. There's still more work to do. We have, in the state of California, shown what happens when you are committed to getting the task done. Because one of the challenges that's happened across the country with the Affordable Care Act, because it's been so politicized. It's hard to believe that getting people health care coverage is so political, but it's got so politicized that unfortunately there are many other parts of the country that have not been fully committed, and there's still a lot of conflict and debate. But here in California, we've all said we're going to work together and make this work. It's not a perfect law, but it's something that's going to move us to a better place. We've been working hard on the coverage part. Proud not only to act on the legislative arena, but also going out and supporting enrollment entities and bringing people together and going out to enrollment fairs and really encouraging people. Very proud of the work done by many organizations like SEIU, UHW, partnered with them, Sacramento Covered here locally, Planned Parenthood, the Asian Chamber, the Black Chamber. There's many other, Mayor Kevin Johnson. We've all come together to try to make the ACA successful here. Now, coverage is only the first step. We also need to work to improve our healthcare delivery system in a way that we can bend the cost curve. So when I was chair of the Assembly Health Committee, I worked on focusing on how do we address chronic disease management. We spend 40% of Californians have a chronic disease. We spend about 80% of our healthcare dollar on that. We need to improve the quality of care we give to people with chronic diseases. And we need to think about how we deliver that care. It's not just about how much we pay doctors or hospitals or nurses and everyone else. It's also about how do we how's that care organized? And we need to have the right kind of incentives to do that. And so even as we're working on getting people covered, we also need to work on looking at our healthcare systems and how we can improve those. I'm particularly interested in both doing pilots in my own community, in my own district, to try to help people with chronic illnesses in our most vulnerable communities, partnering with many other community organizations, and then on a policy level, working on policies that are going to create the right kind of incentives that's going to improve the quality of care and chronic disease management. Because it's great we can get people covered, but we also need to be sure they get access to quality care. We need to look at access to physicians. We also need to look at the Medi-Cal program. Medi-Cal is 30% of all Californians on Medi-Cal. Actually, almost half of all children will be on Medi-Cal, or actually are on Medi-Cal. So we need to be sure those systems also work effectively. It's not just that other program for people who are poor. It's a program that's covering a large number of Californians. California needs to step up, be sure they have high quality care, that there's access is good in Medi-Cal. The auditors noted some difficulties on access to dental care. We've seen there's challenges with access to specialty care. Payment rates have been among the lowest in the country and leading to access problems. We need to work on that to be sure that those Californians get access to the quality care they need. And ultimately, it's about, as we're getting everyone covered, we need to be sure they all get preventative care. We need, and that we can really bend that cost curve in the end. Because I know the governor said in his address to us at the beginning of the year, he's worried about healthcare costs. I'm worried about healthcare costs as well.
Well, that was my question. The next question to you, when it comes to affordability and access and prevention, fiscally, can we do this here in this state? It's getting better, but I think our population grows.
Yes.
What do you say?
Well, I think we can, but we have to think creatively about it. It's not just about saying, well, we're just going to keep cranking rates down, which we've done in Medi-Cal. It's really about creating incentives for coordinated care, medical home, Patient-centered medical home is a model where people get their care coordinated through a physician-led team. I think that's a model that's been proven to lower costs. I actually visited a medical home project down in Fresno, California, where the Fresno School District actually worked with their employees to better manage employees who had chronic illness, and that's lowering their cost because the most expensive place we can take care of someone's in a hospital in the ICU, right? And what we need to do is figure out, and we're very good at patching people up when they get really sick. And one of the challenges we have is that we have a system that's designed that what happens when you get really sick, we spend lots of money patching you up, and if you survive that, we send you back home, and then we kind of ignore you. We don't really invest very much in, and we need to invest more up front to help take care of you in between, so you don't end up in the hospital, right? We need to invest more in prevention. So these are the things that we need to look at. How do we encourage these improved systems of care, coordination of care? That's really where the opportunity is to give people higher quality care at a cost that they can afford. And then that's really what it's about.
Senator, you have your plate full between monitoring communicable diseases here in California and taking care of kids, and also being an ambassador on the Affordable Care Act and the equality and access. So I want to bring you back one of these times to have further discussions on all this and see how it all rolls out. Thank you for coming in.
Well, thank you.
Great to have you here. Senator Richard Pan, he's Dr. Senator Pan, Dr. Richard Pan from Sacramento, and we're glad to have you on. Thanks for joining us here on Senate Spotlight.
Thank you.
And that is it for this edition of the program. Please join us next time around as we discuss important legislative issues and policies with the newsmakers and newsbreakers of the California State Senate. From the state capitol here in Sacramento, I'm Brian Green. Thanks for watching.
Thanks for watching Senate Spotlight.